Okay, everyone can hear me? Nod your head. Okay, so we are, I have a couple chats here that I'm just gonna quickly check. So Timothy, yes, go ahead. Carmen, are you still having mic issues? So Carmen, I can't hear you. If you have yourself muted, you can unmute yourself. Otherwise, you can send your questions in via the chat and I will make sure to pick them up at the end. Okay, so we are streaming live on YouTube, so I'm going to go ahead and get us started. Thanks everyone for joining us today on Easter Monday. It's April 13th, and we're here for another media briefing. Today we will have statements from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by a statement from Regional Chair Karen Redman. We also have Mike Murray, our CAO, standing by to answer any questions that you may have for him. We're going to get started. There's quite a few of you lined up to ask questions today. So just a quick reminder to keep your questions to 2 or 3, please, so we can get through this. I will now pass it over to Hsiu-Li. Go ahead.
Thank you. So this morning, I am sad to report that since my update this past Friday, as of yesterday, 7 p.m., we have 3 more COVID-related deaths to report. We are counting all deaths where the person was COVID-19 positive, even if it may not have been the primary cause of death, as can sometimes be the case. I wish to express my deepest condolences to the families and loved ones of those who have sadly passed. The overall number of confirmed cases has also significantly increased since Friday's update, as we have begun a significant expansion of testing since then. As I mentioned Friday, following increased availability of testing kits, we immediately began the process of maximizing testing at long-term care and retirement homes, according to the updated provincial guidelines. All recommended staff and residents in facilities who should be tested are being tested. In line with the updated guidance, we are in the process of completing testing of all staff and residents in 2 long-term care homes who have active outbreaks: Forest Heights, Rivera, and Highview residences. What we're seeing in facilities in Waterloo region is what we're seeing across the province, that these are vulnerable settings where COVID-19 can spread very quickly. As we receive the results of the expanded testing, I expect to see a significant increase in the number of cases detected among residents and staff at Forest Heights, Highview residences, and other homes. These results will give us a clearer picture of the status of COVID-19 in such homes and will allow us to respond accordingly. Knowledge of the new cases detected will help us reduce the number of additional cases in the future. Finally, I'd like to say thank you to our community for staying home this past weekend, for limiting the number of times you leave your home, and for practicing physical distancing when you are out. Thank you for doing all that you can to help our community fight this pandemic. You are making a difference. Thank you.
Thank you, Hsiu-Li. I will pass the screen over to Karen for her statement. Go ahead, Karen.
Thanks, Bethany. I too would like to begin by expressing my sincere sympathies to those who have lost ones to COVID-19. Our thoughts are with those who are currently ill and to family and friends who are worried about them. For those who celebrated Easter this past weekend, I hope you and your families found other ways to reach out to each other over the holidays. While COVID-19 has disrupted many traditions over the holiday season, I personally found great pleasure in connecting virtually with my family, especially my grandchildren.
Okay. Karen has
The doc-
frozen for me. We'll just give it a moment. All right, has Karen frozen for everyone else? Yep, okay. So we will come back to you, Karen, once we sort out your tech problems there. I'm just going to pass it over to the media for some
Information.
questions. Well, oh,
Did I cut out?
you did, Karen. Can you go back about a minute? You were just finishing talking about Easter with your grandchildren, and then you'd move
Okay.
forward.
So I hope that those of you who are celebrating Passover, Orthodox Easter, and Ramadan in the coming weeks will continue to reach out to friends and family. One of the most stressful parts of COVID-19 has been the uncertainty of not knowing when things will return to normal. Many of you are trying to find answers online and social media. I want to encourage everyone to check sources of information you're getting online. Ensure that the information coming is from a reputable source and is evidence-based. A good place for local information is our COVID-19 Information Center on the Waterloo's website.
Okay.
And limiting the amount of times they leave their homes. We know your efforts are working and are more important than ever. You're not only protecting yourself, your family, you are protecting our entire community. Thank you for staying home to protect those who cannot.
Thank you, Karen. You had a couple little glitches there, but I think we pretty much got your message. So thank you. I will pass it over to the media for questions now. Perhaps we can start with Joanna. Are you ready for your questions?
Yes. Dr. Wang, I was hoping you could tell me more about the deaths over the weekend, sort of who they are, age, that sort of thing.
You'll need to unmute yourself, Hsiu-Li. There we go.
Thanks. Yes, thanks, Joanna. So they were all over the age of 70, and they all had other medical conditions. One was from a long-term care home, and the other two were from the community.
And the total number of deaths now is?
I'm just gonna. 11.
11.
Mhm.
And just in terms of long-term care, Forest Heights Rivera has like a dramatically higher number of cases than other homes. Why is that?
They are an active outbreak. That's a large home. I believe it's about 240 or 250 residents in that home. But they are experiencing an active outbreak, and this is what we can see in outbreaks in these types of settings. So we have been working to support them and have implemented additional measures to help minimize further spread, as well as ensure that as in line with the new guidance that all their residents and staff are being tested. So there's a lot of action taking place with respect to Forest Heights to try to minimize further spread.
And just one more question. Hospitalizations peaked early last week, and they've been kind of stable since then. Does that tell us something, or is that a product of it being more long-term care, home residents, and maybe they're not going to the hospital?
It's a very good observation, Joanna, and I've noticed that too. And that's sort of a sign that, okay, so far at this point, it continues to be manageable for hospitals, which is a good thing. That said, that's a good signal, and we'll continue to monitor. But you're right that right now there's additional challenges with long-term care homes. As we've seen now, they are very vulnerable to COVID-19. Vulnerable both in terms of number of cases that can occur, as well as potentially a number of deaths. And so a lot of our focus right now is ensuring that we do what we can in terms of the long-term care home situation. But you're right, on the hospital side, there seems to be less pressure.
Any further questions, Joanna?
That's it for now. Thanks.
Okay, thanks. I'm going to pass it to Damon from the Woolwich Observer. Can you hear me, Damon?
Yep.
All right, go ahead.
Hi,
Okay,
David.
so my first one's for Dr. Wang. I was wondering what the confirmed amount of cases are in the whole region at this point.
Yeah, okay. So we right now have 327 confirmed cases.
And I was wondering if you could tell me if any of them are specifically in the Wellesley or Woolwich townships.
Oh, yeah, so we've received requests to further break down data by geography. So we will take that back. Right now, the data that we have, we're working very hard to provide as much data as we can. It's the data we have on our dashboard, which I don't know if you've seen, but it breaks down data in various ways. And so that's what we have available at this time. But we'll take back your question.
Okay. And then my next one, I believe it's for Mike. I was just wondering, they were saying there's going to be an increased amount of enforcement over the weekend, and if there was any charges made for things like breaking social distancing, if he's available to answer that.
Yep, unmute myself. There was a lot of enforcement activity over the weekend. We had public health inspectors out over the weekend. We had bylaw enforcement officers out over the weekend. I assume that the area municipalities also had bylaw out, and I assume that WRPS was out also. I would say there were no additional charges laid over the weekend. So they inspect. I'll just give you some numbers. Compliance checks, 110 food premises, 84 personal service settings, 114 churches and 1 mosque. Responded to a number of complaints, but everybody was cooperative, and no additional charges were laid in addition to the charges that were laid last week.
Perfect. Thank you, Mike. And that's all my questions for today.
Okay, great. Thanks, Damon. So Nicole from CTV, I'm going to pass it over to you now. Unmute yourself.
Hi, a couple quick questions. Just let me set myself up. Can you hear me?
Yep.
Okay. You mentioned earlier that there's a lot of action and measures taking place at Forest Heights Rivera. Can you just clarify what some of those actions on top of the testing that you are doing over and above what is being done at other long-term care facilities?
Hsiu-Li?
Yes, well, there's a lot of work being done on a daily basis with Forest Heights in terms of connecting with them and getting the latest updates from them. A measure that has been put in place not only in Forest Heights but across other long-term care homes in outbreak or retirement homes in outbreak is the fact that there needs to be masking of staff, in the facilities, regardless of where cases are or how they're distributed. So there's general masking of staff, whether they have symptoms or not. Well, first of all, they shouldn't be working if they have symptoms. So there's general masking of staff across the facilities. That's going to be an important measure that should help with reducing the potential for spread. The other thing that, well, as I mentioned, the other thing was increased testing, which should enable us to have a much better idea of the current status and whether there are additional cases that we haven't yet picked up on. So that should help us further inform the management of the outbreak.
And checking in with the RCMP are now enforcing COVID-19 quarantine orders. And I guess this is for Mike Murray or maybe you, Hsiu-Li. Has the region worked with the Mounties on this? And are there any local cases that you're aware of?
So maybe I'll start, and I'm not sure if Chair Redman or Dr. Wang have anything to add. It's Nicole, it's probably a question better for Waterloo Region Police, because I think they have the direct liaison with federal and provincial law enforcement officers. So as far as I know, the region has not had any direct contact with RCMP, but I think it's quite possible that Waterloo Region Police have had contact with either through the province or directly with federal government.
Yes, so just to add, so we don't have enforcement powers for the Quarantine Act. It's really the federal agencies, and I think they, as Mike said, they will ask for local police assistance if required.
And I would just concur, it's a Waterloo Regional Police question.
Okay, thank you. That's it.
Great, thanks, Nicole. So next on my list is Kevin Nielsen from Global. Can you hear me, Kevin?
Yes. It seems like there was a drastic jump in the number of cases announced this morning. Is there a specific reason for that?
Hi, Kevin. Yes. So we significantly expanded testing since this past Friday. We were able to secure a lot more swabs, as well as the fact that the province updated guidance in terms of the priority groups for testing. And so we actioned that immediately.
It seems like a significant number of the people that have tested positive, a lot more are women than men. Is there any reason for that?
I don't know. I actually don't think that's, I just think it's because we don't have that many cases comparatively to Ontario. Like, we have the number of cases we have in our region, but I just think it's by chance. And when you roll the numbers up provincially, it's about 50-50, I think.
Okay, thank you.
Thanks, Kevin. All right, I'm going to pass it to Irene from the Air News. Go ahead, Irene.
Hi, my question is for Chair Redman. Chair Redman, if a person does not have access to online information, how should they get information?
They can call the region number 519-575-4400, so 4400, and their call will be triaged, and somebody from public health might answer them depending on what their area of concern is.
Oh, okay. And just the second part, is the region doing anything to assist people who don't have access to online? I particularly know someone that only went to the library, and of course that's closed. So is the region doing anything to assist people like this?
So at this point in time, we're suggesting they go to the telephone, Irene, because we have people trained. It's 24/7. They can triage their concerns, and it's probably the fastest way to get their concerns met. There's telehealth too, but I know that that can be days and days till somebody answers back. So the region is a fairly quick response.
Okay, great, thank you.
Thanks, Irene. Okay, so I have Carmen from CBC on who's having trouble with her audio. So I'm going to ask her questions, which she sent through chat. One has already been answered. The second one is for Hsiu-Li. And the question is, with the rapid amount of testing and social distancing measures that are happening, when would public health expect to see a reduction of cases?
Yes, it's a question we'd all like to have an answer to. So at this time, we won't know. And in fact, for epidemics in general, we only know when we've passed the peak.
Yep.
Okay, thanks, Hsiu-Li. Carmen's next question or last question, I believe, would be for Mike. So they have been hearing, CBC have been hearing concerns about the Charles Street terminal with people not social or physical distancing there. And she's wondering if the region is doing anything to address it, and if so, what?
Yeah, so I'm not sure when those concerns were raised. We know that a week or so ago, there were concerns about kind of overcrowding at the Charles Street Transit Terminal that were addressed last week. And I think it's important to keep in mind why we opened that facility. We opened that facility as basically a place to provide washrooms for people who have no other access to washroom facilities. So that's how it started. It evolved a little bit into, a place for people to drop in, hang out for a little while. I think that was creating the challenges with physical distancing. And so what we've implemented now is kind of access for a couple people at a time to the washrooms, just the washrooms. So that's what's going on at Charles Street Transit Terminal. There's a lot of work going on with a whole bunch of community partners, the region, the cities, to try to open up more daytime drop-in space for people who have no place else to go during the day. So that work is actively underway, and I'm hopeful that in the next few days to a week, we'll have more information about daytime drop-in spaces.
Thanks, Mike. I see a third question here from Carmen. Looks like it's for Dr. Wang, and she wants a little bit of clarification around why the region or public health, are not releasing specific case information related to geographical areas or cities and townships.
Coming. Unmute, Hsiu-Li.
Mike.
Sorry. Yeah. So there's a couple of things I'd just like to say. So first of all, the risk of acquiring COVID-19 is across the region because there is broad circulation of COVID-19 across all parts of the region. We have gotten that request to break down, geographically, and we're taking that under advisement. We have put forth on our dashboard, measures that we thought were helpful for the community to understand, and we're happy to take feedback. So it's something that we'll take under advisement. But I want people to understand that the risk is everywhere in our region. The other thing I want people to understand also is that due to the prioritized groups for testing, such as long-term care, those living in long-term care homes, which has been further expanded since the end of last week, we are going to have a disproportionate amount in certain areas of the region due to the fact that all of this testing is being concentrated in places like long-term care homes and retirement homes. They are not geographically uniform across the region, right? So there will be some effects in terms of numbers in specific area municipalities as a result of that. So just a couple of caveats about the numbers when they appear. Yeah, just and for people to understand that the numbers are not going to necessarily represent, they're not going to represent a true picture of the risk across our area municipalities. It is everywhere across our region.
Thanks, Hsiu-Li. I'm going to pass it to Timothy from 570. Can you hear me, Tim?
Yeah, can you hear me?
Yes.
Okay.
Go ahead.
My question's for Mike. Have you thought about utilizing facilities like the Memorial Auditorium or Waterloo Rec Complex as a homeless shelter?
So we have several spaces for homeless shelters. I think you're aware because we announced it a little while ago. The YMCA was generous enough to make available the A.R. Kaufman Y. And so So that is being used now as a homeless shelter. So we've got adequate number of shelter spaces. Up to and including this weekend, we have more than enough shelter spaces to accommodate everybody who's seeking shelter. So it's not so much a challenge of finding more physical spaces. And we've got overflow arrangements in local hotels, motels, if we need to. So we believe in terms of capacity in the shelter system, we've got adequate capacity. The challenge we're dealing with right now is a couple-fold. One is daytime space. So places for people to go, get warm, hang out, maybe get a meal during the day. So that's something we're intensely focused on right now. And the second issue, it's related to that, is just finding people to staff those operations. Both enough staff to staff the shelters overnight. They're quite stressed in terms of staffing levels, and also to find enough staff to staff daytime operations. So it's not so much a physical space issue right now, it's a staffing issue, and it's a daytime programming issue. And we got to find the right people, who are comfortable working with this group of people, and make sure that everybody can stay healthy and safe in those operations.
That's great. Thank you.
Nothing further, Timothy? Okay, great. So I just see that Kevin Nielsen from Global has asked an additional question, which I think is a quick answer. So this is for you, Hsiu-Li. And Kevin asks, on the dashboard, are the people who work at residential or long-term care homes part of the healthcare totals? Unmute yourself first, please.
Sorry about that. So if you, you may notice at the bottom of the healthcare workers graph, it says we're counting those who provide direct client care as healthcare workers in that graph. But the people that could be tested in long-term care homes can include those that do not provide client service, and they're included as part of the staff total, as long as they live in our region. If they don't live in our region, then we wouldn't get that information about them. They'd be included in another health units totals. But for the residents, sorry, for the staff who live in our region, they're all counted in our dashboard in the long-term care retirement home listing. And that's another thing that we're trying to work on in terms of our data, is to also provide some data on perhaps overall number of staff who have been tested and who have tested positive, overall number of staff who have tested positive. But right now, what it says on our dashboard, what it means is those who provide direct patient care.
Thanks, Hsiu-Li. Okay, I trust that answered your question, Kevin. And I will open it quickly for any final questions, or perhaps people I missed. I don't think I missed anyone. Everyone's good. Okay, before we end, I just want to
have a quick question.
Oh, sure. Sorry, go ahead.
They're just writing about grocery stores and wondering, I don't know if Dr. Wang or maybe Mike or Karen can answer this, but a lot of grocery stores have moved away from allowing people to use their reusable bags, which is obviously a sustainability issue because people are trying to be greener. But now that's not an option in a lot of grocery stores. So is that something you guys support, or just your feelings on that?
Who wants to take this?
Well,
I'll take. Okay, Mike, go ahead.
You go ahead, Karen.
I was just going to say, I think it's a sign of the times, Joanna. I find it somewhat troubling. I have been to a few stores. My husband does most of the grocery shopping, but when I went, if you took your own bag, you had to pack it yourself. They wouldn't touch it and they wouldn't fill it. So that seemed a bit of a middle ground, but I think it's a sign of the times that people are putting the threat of COVID-19 over even environmental issues.
Yeah, and I think that's quite apt. And I might just add, I'm hoping that that's a temporary, like many of the things we're dealing with, I'm hoping that it's a temporary thing because, we do know that reducing single-use plastics is pretty important from an environmental sustainability point of view. So, I'm hoping that once we get through this, that we'll be back, people using reusable bags and cloth bags, and trying to get away as much as we can from single-use plastics.
Great, thank you.
Thanks, Joanna. Okay, I think that's it for today. Oh, I have Nicole raising her hand.
This is a follow-up, I guess, to Joanna's question. We have listed, outbreaks at long-term care homes and whatnot. What about, because people go grocery shopping and there are some grocery stores where employees have tested positive for COVID-19? Is that something that the region will potentially track, given that's a place where people are allowed to go to?
No, because that's what we consider community spread, and we should just assume that it's across the region, right? It's not, the reason we do that for long-term care homes and retirement homes, Nicole, is because these are closed settings, and these are particularly vulnerable settings where we've seen that it can spread very quickly and cause a number of deaths. Whereas other public settings, it's different. For all other public settings, we consider the risk to be the same, and that people should just be aware that they could come into contact with COVID-19 anywhere in the region.
Okay, thank you.
Okay, thank you. So before we sign off, I just wanted to give everyone a quick reminder that we're adding quite a bit of information to our website. So we have substantial health related information, but we're also adding an entire information COVID information center, which Karen referenced earlier. And every day we're adding to it. So just keep checking back. The one thing I did want to point out for the media in particular is after every media briefing, we will post Karen and Hsiu-Li's remarks to a page on the website, usually within an hour or two. And I think we started doing that on March 27th. So if you want any clarification around fact checking, sometimes it's good to check these notes. And you can find them at regionofwaterloo.ca/media briefings. If you have any questions about that, you can just send me a note. And if there is nothing further, we will do this again on Wednesday. Thanks again for helping us share these messages, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.